Examination of the facial nerve. The facial nerve is predominantly a motor nerve with parasympathetic and sensory components. The sensory division is separate from the motor division and is sometimes referred to as nervus intermedius. It supplies muscles of facial expression. The efferent parasympathetic fibers initiate salivation, lacrimation, and mucous membrane secretion. It also carries taste from the anterior 2/3 of the tongue via chorda tympani. Assessment of the facial nerve involves the examination of motor function, sensory functions, secretory functions, and reflexes. Examination of motor function. The motor function of the facial nerve is tested by checking the movements of the muscles of the face. Ask the patient to raise the eyebrows, wrinkle the forehead, close the eyes as tightly as possible, show the teeth, blow out the cheeks against the closed mouth, purse the mouth, and whistle. A lower motor neuron lesion results in paresis or paralysis of all the ipsilateral facial muscles. To test for the sensation of taste, examine the anterior 2/3 portion of each half of the tongue separately. With the patient's eyes closed and tongue protruded, take a tongue blade and smear a small amount of test substance on the lateral surface and side of the tongue. Instruct the patient to tell you the identity of the substance. Rinse the mouth thoroughly and repeat the test on the other side using a different substance. Use strong solutions of sugar and common salt and weak solutions of citric acid and quinine to test for sweet, salty, sour, and bitter taste, respectively. To test for lacrimation, Schirmer's test is used. Keep a piece of special blotting paper under the lower eyelid and remove it after 5 minutes. Normally, at least 10 millimeters of the blotting paper will be dampened by the evoked tear secretion. Note that abnormalities of salivation are obtained through proper history taking. The reflexes tested for the facial nerve include the corneal reflex and the stapedial reflex. Corneal reflex. Stimulation of the cornea with a wisp of cotton produces reflex closure of both ipsilateral and contralateral eyelids. The facial nerve carries the efferent impulses. Stapedial reflex. The stapedial, or acoustic reflex, is the contraction of the stapedius muscle, elicited by the presentation of an acoustically loud sound. Absence of reflex or reflex, less than half the amplitude, suggests a lesion, proximal to the nerve, to stapedius. Bell's palsy, also known as idiopathic facial palsy, is a form of temporary facial paralysis, caused due to dysfunction of the facial nerve. The exact etiology of Bell's palsy is unknown. Generally, Bell's palsy affects only one side of the face, however, in rare cases, it can affect both sides. Symptoms appear suddenly, over a 48 to 72 hour period, and generally start to improve, with or without treatment, after a few weeks, with recovery of some or all facial function within 6 months. In some cases, residual muscle weakness lasts longer or may be permanent. Symptoms of Bell's palsy include sudden weakness of one side of the face, drooping of the mouth, drooling, inability to close the eye, and excessive tearing in one eye. Individuals may also have facial pain or abnormal sensation, altered taste, and intolerance to loud noise. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.